Hello, I'm Yulin Holder. I'm a senior psych student and I'm working with Professor Wang to try to understand the differential impact of the COVID-19 pandemic on mental health. Special thanks to Tonghui for cleaning the data so we could analyze it more easily. So what does this title mean? Well, everyone's mental health was affected by the pandemic, but some populations suffered more than others. COVID exacerbated the long-standing health disparities in our country, and we want to bring attention to that. Our goals are to determine what different mental health trajectories people had during the pandemic and what socioeconomic variables affected those trajectories. Our study is using data from the Household Pulse Survey, which the U.S. Census Bureau began sending out in April 2020 in order to measure how COVID was affecting households economically, socially, and mentally. The survey is actually still being conducted, but right now we're only looking at data from the first 4 weeks of the survey, which started April 23rd and ended May 21st, 2020. For context, as I'm sure you all remember, March 2020 was when the shutdown started and the CARES Act was passed. And then in April, the CDC started to encourage mask wearing, and there were widespread PPE shortages. So we're looking at the early stages of the pandemic. Based on the mean response of 18,406 survey participants, we did find that the severity of mental health symptoms actually decreased over this period of 4 weeks. So in other words, mental health was improving. We're measuring mental health using 4 of the questions in the survey about depression and anxiety, which asked how often in the past 7 days people experienced mental health symptoms like having little interest or pleasure doing things, or being unable to stop or control worrying. They could choose to respond 1, not at all, 2, several days, 3, more than half days, or 4, nearly every day. A possible explanation for these results could be that people are just starting to adjust to the lockdown. Maybe they're enjoying spending more time with family or experiencing the benefits of working from home. However, it's important to remember that this is only data from 4 weeks, so if we extend our time period, there could be a different trend. In the future, we'll be trying to break down this data a bit more. On average, people are doing better, but when we look at the data at an individual level, there could be more variation. This graph is a simplified example of what that could look like. We want to see if individual trajectories can be grouped together and then figure out what determines a person's group. For example, does being older mean you're more likely to follow the purple trajectory and the severity of your mental health symptoms decreased more? Or maybe your trajectory is determined by your gender or sexuality or race. We're also going to consider things like income, food sufficiency, and insurance coverage. Having this information will help healthcare providers identify groups that need more support and then allocate resources accordingly.